Hi, so my name's Madison. I'll be the PA student doing your history and physical today.
Hi.
So can I just verify your name and date of birth first?
Yeah, it's Julie Folger, and my date of birth is 1/4/1996.
Okay. All right, Julie, so what brings you in today?
I'm just having this really, really bad, sore throat and runny nose. My ears hurt a little bit.
Okay, and how long has that been going on?
Maybe 3 or 4 days.
3 or 4 days. Okay, so tell me a little bit more about it, about what's going on.
I don't really feel that well. Lethargic. My nose is stuffy. I constantly have to blow it. My throat hurts. It feels like I'm swallowing razor blades. My ears are a little bit painful.
That sounds awful. Have you had anything like this before?
Yeah, I have.
Tell me a little bit more about that.
I think it was a cold. It seems like a cold to me. I don't really know. I mean, I had this maybe a couple years ago, and it was the same symptoms.
That sounds awful. The sore throat and stuffy nose.
Yeah.
Are you able to blow anything out or cough anything up?
I can cough things up. I don't really know the color of it or anything. I don't really look at it, just kind of throw it away. I've been doing the nasal sprays just to get everything kind of out of my nose.
Okay. Has that been helping at all?
A little bit when I do it.
Are you doing anything else other than the nasal sprays?
When I have a minor headache, I take Tylenol.
Tylenol. How often are you taking that?
Maybe once a day.
Once a day? And is that helping at all?
A little bit with the headaches, but not with the throat pain, the runny nose, the ear pain.
So just with the headaches?
Yeah.
So did you notice anything before any of this happened, or did it all just kind of come on at once?
I would say it started off with a cough and a stuffy nose, and then it progressed more into the throat, ear area, too.
And are you noticing anything that's making it worse?
No, it's just all the same, just hurts.
It's all the same, even in the morning, night, all throughout the day, the same?
I would say morning and night it's a little bit worse.
Morning and night it's going to be a little worse. Okay. And let's say, in general, let's say you're doing a scale of 1 to 10, 10 being the worst pain you've ever had. How would you say you're feeling now?
I would say about a 6.
About a 6. Has it been a consistent 6 since you got it?
No, it's progressed to a 6. I would say it started at maybe a 3.
A 3. Okay. And that's a 6 more morning and night that we're seeing here?
Yeah.
Okay. Okay, so you started off with the cough and the stuffy nose, and then started to get more of the sore throat and runny nose.
Yeah.
Headache. Anything else I'm missing there?
I don't think so.
Okay. Have you noticed any fever?
I haven't taken my temperature.
You haven't? No chills, though, or anything?
At night, maybe a little bit, sweating.
And how long has that been going on?
Just recently.
Just recently? So within, the last 3 or 4 days?
Yeah.
Okay. Have you noticed any, changes in, your skin? Any, rashes you've noticed?
Nope.
No, nothing like that? Okay. Let me see what else. Anything that you're noticing with your eyes, tearing or blurred vision?
No, nothing in my eyes.
No itching at all?
No.
No? Okay. Ears, are you noticing any, earaches?
Yeah, a little bit of ear pain.
You do have ear pain? Tell me a little bit more about the ear pain.
I would say it's just a general ear pain.
Just a general ear pain?
Yeah. Hurts more when I touch it.
It hurts to touch. And how would you rate that pain?
7.
7? Oh, that's pretty bad.
Yeah, it hurts.
So would you say that's your biggest complaint is the ear pain then?
I would say ear just because I'm so not used to it, and then I would say throat next. It hurts just as much, but I would just say just the ear pain. It's annoying.
So you haven't ever had the ear pain before?
No.
No? Okay. Is anything making the ear pain worse?
I can't lay on my side when I sleep, but besides that, not really.
Okay. And is it just on the one side that
Yeah.
you're getting the ear pain?
Yeah, to my left.
Okay. So on your left side. Have you done anything to try and make it a little better?
No, I didn't know what to do.
Let's see what else may be going on. Any, like, are your ears ringing at all?
No.
Any, like, dizziness, anything like that?
No.
No? Okay. And you said for your nose that you have the nasal stuffiness. And, like, it's running.
Yes.
Is it itchy at all?
No.
No, not itchy.
Not itchy.
Okay. Are you having any nosebleeds?
Nope.
And you said the last time you only had this like a couple years ago. You haven't had any other colds recently?
No, I would just say this is the first one since a couple of years ago.
Okay. And about how many? Do you know about how many years ago? Take a guess.
I would say 2014.
14.
Yeah, 2014.
So about three years ago,
Yeah.
like you said. Okay. Are you noticing like any neck pain if you touch it at all?
Yeah, my throat hurts and when I swallow.
When you swallow, you're noticing it more.
Mm-hmm.
Are you noticing like any like the swollen glands, like if you touch like beneath like your jaw?
Yeah, they seem a little bit bigger than normal.
Do they? Okay. Are you having any chest pain with it?
No, just more up in the throat area.
Any problems breathing at all?
I have exercise-induced asthma, so like a little bit, yeah.
So tell me a little bit more about that exercise, the exercise-induced asthma.
I would say it's worse. It's like really bad when I exercise, especially when I don't take my inhaler. But I've been trying to take it a little bit more just because I've been having this like cold and my mom's a nurse, so she told me to take my inhaler.
It's always good to listen to your mom.
Yeah.
So how often are you taking the inhaler? Normally, when you're not sick?
When I'm not sick, usually before I exercise, but I'm not really that compliant with it, so I would say every other exercise maybe. Or if I'm running, I kind of have to take it. But like if I'm lifting, I don't have to take it. And then now I would say I take it like every other day. I've taken it twice since I got the cold.
And is that just before exercise about every other day? Or is that just every other day?
It's just before exercise.
Just before exercise?
Mm-hmm.
Okay. And is that helping at all?
Yeah.
Okay. And how long have you had the inhaler in general?
I would say since I was like 9 maybe, so 11 years.
11 years. Okay. And do you feel like your asthma is pretty well controlled, or?
Yeah, I would say it was just like at its worst when I was playing sports every day, so then I would take it right before my sports games or whatever, just in order to like get through the game. But now it's just more like I want to work out, so I have to take it.
That makes sense. Okay. So you have the asthma. Is there any other medical conditions that you have that maybe you're being like treated for?
No, it's just the asthma.
Just the asthma? Okay. Do you have any other medications other than that inhaler?
Yeah, I'm on birth control.
Okay. Do you know by chance what the name of that was?
Yeah, I'm on the NuvaRing.
And how long have you had that now?
Maybe a year. I switched from oral contraceptives to the NuvaRing a year ago.
Why'd you switch?
Because it was a pain taking a pill every day.
Did you forget to take it every now and then?
Yeah.
And how's that working for you?
Good.
So you like that? No changes you want to make with it?
No.
Comfortable with that one?
Mm-hmm.
Okay. So you have the inhaler, the birth control,
Mm-hmm.
anything else?
Nope.
Nope. And you've been taking just the Tylenol and like the nasal spray?
Yeah,
during this.
exactly.
Is the nasal spray like an allergy nasal spray or just like a saline?
A saline.
A saline. And how often are you doing that now?
Once a day.
Once a day? Okay. Do you have any allergies at all?
No.
No allergies? Mm-hmm. Not to like medications, food,
Nope.
nothing like that?
Nope.
Okay. No latex allergy, iodine,
Nope.
nothing like that? Okay. Alright. Now let me just make sure I'm not missing anything with this. So you said you have a little bit of a cough and you're coughing stuff up, but you don't remember what it looks like. Does that sound right?
Yeah, I am coughing stuff up, but I don't know the color.
I don't know the color. Are you coughing it up in the morning, night, or like all throughout the day?
I would say when I get my really bad coughing fits, I'll get stuff up, but besides that, I kind of like feel something's there and like can't get it up.
That's the worst feeling.
Yeah.
How often are you having the coughing fits?
Mostly at night.
Mostly at night. Is it waking you up in the middle of the night or before you go to bed?
It's right before I go to bed, and then my roommates say that they can hear me coughing throughout the night, but I don't really know I'm coughing.
So it's not like waking you up?
No.
That's good. At least you're getting sleep. Okay. Let me see what else. You're not coughing up any kind of blood that you've noticed?
No.
No kind of blood? Okay. Any like wheezing, like when you breathe in or breathe out?
No.
No. Pain with a deep breath?
No.
No. Have you ever had a chest x-ray?
Nope.
Any bronchitis that you know of?
When I was little, I think I had bronchitis and pneumonia.
Okay, so tell me a little bit more about that.
I was 2, so it was 1996. It was 1998. All I know is I was like hospitalized for it and put on medicine and stuff, and then I got better.
Wow, that's really scary
Yeah.
for a 2-year-old.
Yeah.
And that was for both of them, were like at the same time?
I think so.
You haven't had any other hospitalizations?
No.
It was just that one time?
Right.
Okay. And you've never had pneumonia or bronchitis before?
No.
Other than
when I
that
was 2.
experience. Okay. So bronchitis, pneumonia, you have the asthma. Have you ever got like a PPD for tuberculosis?
Yeah, I had to get it for school, but it was negative.
It was negative?
Mm-hmm.
Good. Okay. So then we'll just talk about vaccines while we're on the topic. Have you had your measles vaccine?
Yep.
Mumps?
Yep.
Chickenpox?
Yep.
Rheumatic fever?
No.
No.
I don't think so. I don't know.
I know it's hard to remember all these
Yeah.
vaccines. Scarlet fever?
Probably.
Polio?
Yep.
Any history of like psychiatric disorders in your family?
Nope.
No. Not even with parents, siblings, grandparents?
My brother.
Your brother?
But not diagnosed. Undiagnosed.
Undiagnosed. Okay. Do you normally get your flu shot every year?
Yeah.
Okay. Have you had it yet this year?
No.
Okay. Sure. When you're not sick, remember to do that.
Yeah, okay.
How about the tetanus?
Yep.
Diphtheria or the DPT?
Yep.
You have had that? Okay. Hepatitis B, have you had that before?
Yep.
Okay. You wouldn't have had your pneumococcal because you're too young. You haven't, even with asthma, you haven't had a pneumococcal vaccine?
Nope.
No? Okay. So any major adult illnesses, I know we talked about the asthma and the bronchitis when you were younger and pneumonia when you were younger, but anything else
Nope.
now? No? Any history of hypertension with yourself or within your family?
My mom doesn't have hypertension, but she has high cholesterol.
She has high cholesterol. No other history of high cholesterol or?
No.
How about diabetes? Any history of that?
Nope.
Any history of tuberculosis?
Nope.
Heart disease?
Nope.
Lung disease?
Nope.
Kidney disease?
Nope.
Thyroid disease?
Nope.
HIV?
Nope.
Seizures?
Nope.
Cancer?
Yeah, my mom has had breast cancer.
And how's she doing now?
Good. She's all treated. She's done. Yeah,
She's
in
good.
5 years.
That's great.
Yeah,
That's
cleared.
really great. So she's been good to go.
Yeah.
Okay, good. Any history of asthma outside of yourself?
No.
No. So you're the only lucky one to get it.
Yeah.
Any history of hepatitis?
Nope.
Okay. But I know these are a lot of questions.
That's
I'm
okay.
sorry. I just want to make sure I'm not missing anything.
Yeah, it's okay.
How about any like accidents, injuries, broken bones, anything
Nope.
like that?
Never broken a bone.
Not even with sports?
Nope.
What sports did you play?
Soccer and softball, and I swam for a little bit too, but not in high school.
You swam, so you were a big athlete.
Yeah.
How long were you playing? What was the sport you played the longest or your favorite?
I would say soccer and softball were the longest. Since I was like 2, I played both of them.
Since you were 2.
Mm-hmm.
That's a really long time. Are you playing now while you're in school?
No, I'm not.
No.
I couldn't keep up with it.
So you said the only hospitalizations you had were the pneumonia and bronchitis.
Right.
In 1998 when you were 2?
Yep.
Okay. And that was treated. You've been good since.
Yeah.
No issues. Okay. How about any surgeries, even like wisdom teeth?
Yeah, I didn't think of that, but yeah, I had my wisdom teeth removed.
Do you remember when that was?
This year.
This year. And how was that?
Yeah. It's painful. Not at first, but when the pain medicine runs out, it's really bad.
Yes, it is. How are you feeling? When this year was it, I guess I should ask.
In December. So it's been a while. I haven't had anything since. It was maybe like a period of 2 weeks. I was really swollen and pain, like intermittent. When the pain medicine would run off, it hurt. But besides that, it's been good.
It's been good.
Mm-hmm.
What did you eat? I always have to ask.
Yogurt.
Yolk.
Like all soft foods because I couldn't do the crunching.
Mac and cheese was always my
Go
way to go with wisdom teeth. That's what I always tell everyone, eat mac and cheese. So no major like complications, infections, nothing like that with the wisdom teeth?
Nope.
Okay. So you're good to go now?
Yep.
No jaw pain, anything like that?
Nope.
Okay. Any other surgeries?
Nope.
No? Okay. Have you ever had, just talking about kind of like your screenings and stuff like that, I know we already talked about vaccines, but you ever had a like colonoscopy?
Nope.
No? Have you had a pap smear yet?
Yep.
And when was that?
In January, so this year.
January of this year? Did they find anything on it? Any abnormalities?
Nope.
No? And have you ever done any like breast screenings with your mom having like breast cancer?
Nope.
No? Okay. You have had a DP test before. Was that this year, you said?
Yep.
Okay. How about like a DEXA screening for like bone density? Have you ever had that? Cholesterol testing at all?
Nope.
No? Any like blood stool testing that you've had done? No? Okay. Let's talk a little bit more about your health history. So you're on the NuvaRing, correct?
Yep.
Okay. Right. And remind me again, when did you start that?
This year, but I started like oral contraceptives in general, like switching over from the pill to NuvaRing was last year, but I started on it, I would say my senior year of high school. I started on the pill.
And did you ever like have any lapse of like not using that?
Yeah, my freshman year of college, I didn't use it.
You did use it. Any reason why?
A lot of weight gain.
A lot of weight from the medication?
Yeah.
Did you just change your medication then, or?
And then I went off of it, and then I went on the NuvaRing because they said, like, my other doctor said that because maybe it's more direct, the hormones will go, like, right there and don't have to, like, go through your whole body or something like that. I don't know if he was 100% correct, but...
Have you noticed any weight gain, though, or are we content on the NuvaRing?
I'm content with the NuvaRing.
But no, any symptoms from it that you're not crazy about?
No, I think I'm good.
Weight gain is always the worst thing to have.
Right.
So at what age did you get your first period, if you remember? I know it's a while back.
Maybe 14.
14? And how often are you getting your period?
Once a month.
Once a month? So that's normal?
Yeah.
And how many days is it lasting?
Like 7.
So you get the full 7 days?
Yes, I do.
How heavy is it normally?
It's pretty heavy.
It's pretty heavy. Is it are you having like a lot of cramping with it? Is it very uncomfortable?
I would say more back cramps I get than front cramps.
Do you do anything to relieve that?
I take like ibuprofen or Tylenol.
Is that helping?
Yeah.
Okay. So just 7 days of Motrin ibuprofen?
Yeah.
Yeah. And when was your last period now?
Last week.
Last week. Okay. Have you ever had any like lapse in not getting your period? Did you just go through a period of that? No. Any like extremely painful periods, like that nausea and vomiting. And,
No.
And you had a pap smear this year.
Mm-hmm.
Okay. And no abnormalities, right?
Correct.
Okay. Well, have you ever had a history of STIs?
Nope.
No. Have you had testing done?
Yep.
When was the last time you had testing?
At my physical in January.
Okay. Have you ever been pregnant?
Nope.
No abortions or anything?
Nope.
So I know we already talked a little bit about your family history, but I just want to make sure we didn't miss anything.
Okay.
So tell me a little bit about your family, like your mom and your dad, and I think you said you had a brother, right?
Yep.
Okay.
So my mom is 56. My dad's 56. My brother's 24.
So pretty close in age.
Yeah.
Okay. Grandparents?
My grandparents on my mom's side both passed away before I was born. I think one passed away when they were like 70, and the other one passed away when they were like a little bit younger, maybe like 60.
If you don't mind me asking, do you know how they passed away?
One passed away of just like old age. I don't know. He had really bad dementia. I don't know why specifically he passed away.
Okay.
But the other one had a stroke.
Do you have a history of stroke in your family that you know of?
Not that I know of.
No. Okay. How about the grandparents on your dad's side?
One of them passed away, my dad's dad, of cancer. I think it was something, a GI-related cancer, when he was like in his 60s. And then my dad's mom is still alive. She's 75, I think, and in good health.
She's in good health?
Yeah.
No major issues there?
Not that I know of.
That's great. Good for her.
Mm-hmm.
Do your parents have any medical conditions at all?
My dad's pretty good. I would say my mom has high cholesterol and then the breast cancer. But no, that's good, I think.
That's it, just the high cholesterol and breast. Is your mom getting treated for her high cholesterol then?
Yeah, I think she takes medicine. I don't know which one, but.
Okay. And you said you've never been tested for the high cholesterol?
No.
How about your brother? Do you know if he's ever been tested for it?
No, I don't know if he's been tested.
Okay. Does he have any medical conditions at all?
He has a lot of battles with a lot of mental illness.
Okay.
Really undiagnosed. Yeah, he was diagnosed with ADHD when he was like super little. Was on medicine for like a little bit when he was little, and my parents could regulate it. But when he got older, my parents would stop regulating it and stop taking like his medicine. Besides that, it's like just very like undiagnosed because he doesn't want to like see anybody. So.
Okay. Tell me how that is with like family life, like how that.
It can be hard sometimes. Like growing up, it was a little bit hard, but I had to like really like compartmentalize. Now I just like don't really talk to him. And like stay away from him as much as I can.
Is that the same for your parents too?
They're torn. Like it's their son, so I mean they go back and forth. Yeah. Like right now, usually my mom's not talking to him, but now my mom's talking to him, and my dad's not, and dad's usually the one who's talking to him. So it just goes back and forth. I just try to stay out of it.
Sounds like a lot of stress to be dealing with.
Yeah, it is, but it's manageable. If it wasn't,
okay,
I would tell you.
All right, yeah, please do. Tell me if it just gets a little too much.
Okay, thank you.
So you've never had any pregnancies, so no children,
correct?
Okay. Any other family members, aunts, uncles that you can think of anything major with?
Not that I know of.
No? Okay. All right, and no, I'm going to go down the list again, and just let me know if it pops into your mind that you're like, oh, I remember my mom.
Okay.
Okay. How about headaches?
My mom gets headaches.
Your mom gets headaches?
Yeah.
Are they migraines, headaches, both?
I would say migraines, like, occasionally, but she takes, like, ibuprofen, and that helps.
So she's not on, like, any prescription meds?
No.
Okay. Do you get any migraines as well?
Yeah, intermittently.
You do?
And I get, like, a headache maybe, like, once a day.
That's pretty often.
Yeah.
Tell me a little bit more about the headaches.
I can, if I take, like, ibuprofen or Tylenol, that helps, but I don't want to take it every day, so I try not to, and usually it has to do with, like, sometimes I'll like manage it better. Like I'll take down my hair if it's like really bad.
I like that one 5 really fast.
Oh yeah.